So yeah, no, we don't have any masks, guys. We're completely out. Stop asking. I think we get that question like maybe 10, 20 times a day. I'm not sure, but no, we don't have any, unfortunately. Do we? Oh, my bad. It's also very important for you to know that right now this is being filmed. It's February 26, 2020, right? Yeah, 2020. It's very important, and the reason why I say that is because these numbers will be changing. So we're going to be talking about a little bit about numbers, and it's very important for you to know when this was filmed because this changes by the minute, by the day. But it's very important for you not to be freaking out and be looking at these websites that every single day to look at the total numbers of cases and deaths and all this. It's very important for you not to freak out.
Oh my God! Okay, it's happening. Everybody stay calm.
What's the procedure, everyone? What's the procedure?
Stay calm.
Make sure that you ask a lot of questions as much as you can, and like I said, be alert, but don't freak out. That's the most important thing. So what exactly is the coronavirus? It's a large family of viruses that usually are found in animals. This is a very different kind, well, not very different, but it's just a novelty virus, which basically made its way from animals to humans. At least that's what we think so far right now, that's how it was transmitted. And so it's important to know that it is a novelty virus. And now officially it's being called COVID-19. That's the actual disease that it causes. So the virus itself is called SARS-CoV-2. But the disease that it causes is COVID-19, and that means coronavirus disease 2019 because this, believe it or not, started in 2019. So it's very important for us to know the name. It is coronavirus, not caused by the corona. But like I said, it is serious. But again, be alert, but don't freak out. So what are some of the symptoms? Just like the common cold and the flu, you're going to see fever, cough, and shortness of breath. So very, very common. So a lot of people they think they're being misdiagnosed, but it's very important for you to know that it's pretty much very similar to the flu and the cold. If you do think that you have coronavirus, which is very unlikely unless you traveled to China or came in contact with any products that came from China. So it's very unlikely, but it is possible. And the longer the time, the more possible it may become that you do get contracted with corona, or the possibilities are higher. But if you do think that you do have coronavirus, make sure that you call your doctor first. So don't just show up to the office and be like, hey, by the way, I think I have coronavirus, or I need to be seen right now because I think I have coronavirus. It's very important to call your doctor. The reason is because let's say you do test positive for corona, you definitely do not want to walk into a doctor's office and contaminate everybody else there. Especially there's people that are already sick, their immune systems are already down, and then you walk in there and spread this to other people. So call your doctor so that way they can make sure that they make adequate space for you, make sure that they're able to clear out the room, the waiting room, make sure they're able to to adequately take you in. That way you don't spread this to anybody else. So it's very important. Call your doctor first. Make sure you let them know, hey, I think I may have the coronavirus. Explain to them why you think that is, and then they will make adequate space for you and time. That way we don't spread this to anybody else. So make sure that, like I said, call your doctor first and then make an appointment. Don't just walk in there. Don't walk into the hospital. Please don't walk into the hospital if you think you have coronavirus. Okay, guys? Don't do it. So as of right now, there's been over 81,000 cases worldwide of coronavirus. There's also been 2,770 cases that have resulted in death. It's also very important to point out, though, that most of these cases have been in China. 2,715 of those 2,770 cases of death have resulted in China. And so so far we've seen the most, of course, in China because that's where it originated. So it's very important for you not to freak out. So far in the United States, it's only been 57 cases of coronavirus. But of course, those numbers are expected to increase, just, like anything else, they're going to increase. But again, it's very important for you to not freak out. To put this into perspective, the flu this year alone, and this season alone, has killed over 80,000 people, I believe is the last number that I read. 75,000 people is what it's killed so far. And so that's just to put it in perspective. So far, the flu itself has killed over 75,000 people. So it's very important to put it into perspective. Again, it's not, to put it into lightly. It's not saying that coronavirus is not important. It's not a threat. Yes, it is. It's very important for us to be alert. Be very alert, always be alert, but again, don't freak out. It's very important for you to not freak out. Of all the cases so far, 81% of them have been mild cases. That's another important number. So yes, even though there has been 81,000 cases, 81% of those have been mild. 14 have been moderate. and 5% about 5% of them have been critical. And so that's another very important number for you to take into account. So again, be very alert, but also do not freak out. So how exactly does it spread? Just like the cold and the flu, it is spread through air particles. So it's very important that you practice, hygiene. So hand washing all the time. If you can't use soap and water, make sure that you use Germex or any alcohol based product to make sure that you're always using, you're always cleaning your hands. So through air particles, through surface contact, I think the last time I read it's about 2 to 6 hours on surface that the virus will survive on the surface. So on common areas where people use a lot, make sure you're using a lot of Lysol, you're cleaning down, and make sure you're always cleaning your hands. So washing your hands with soap and water, hot soap and water. Very important to know, it does not infect your pets. There's been a lot of pictures of people putting masks on their pets for whatever reason. There is no evidence right now that it is transmittable to your pets, so don't be scared about that. The incubation period, which means the amount of time that it takes for the virus to spread in your body and for you to start showing symptoms, is about 1 to 2 weeks. And it also has been shown that during those 1 to 2 weeks, you're actually able to infect other people. So that's very important, because right now you may have the virus and you don't know it, and you may be spreading it to other people. And because 81% of the cases are mild, you may not even see any symptoms. So you may be at home, you may have the coronavirus and have no idea, because you show no symptoms, and 81% of those cases are very mild to no symptoms. And so therefore that's another reason why you shouldn't freak out, because like I said, 81% of those are very mild. So I think the last estimate I saw, 70% of the United States, they're thinking will be infected with corona at some point or another, but those 70% will not show any symptoms. And so it's very important for you to not freak out. So how exactly do you treat the coronavirus? Right now, there is no way to treat it directly, at least, just like the cold and the flu. All we can do is give supportive care. So if you're dehydrated, give fluids. If you have a fever, give antipyretics. So like Tylenol, Motrin. If you have pain, treat that. Keep the patient as comfortable as possible. Try to build up their immune system on their own. So there is no direct medication that you can take. For the flu, there is a medication like Tamiflu. There is currently in the work in a vaccine. So the NIH is actually working on a vaccine. Unfortunately, that vaccine will not be ready for, the last estimate that I have was a year to 18 months, 16 months. And so there won't be a vaccine ready till then. Hopefully, we can weather the storm till then. Hopefully, it doesn't get as, worse, but we do have a lot of protocol in place to be able to help us through this, to weather the storm. But again, stay very vigilant. At this point, it's very unlikely that you will come in contact with it. But again, be very vigilant and call your doctor in case you do think that you may have come in contact with corona. But as of right now, there is no treatment. It's very important for you to. There's a lot of messages that I'm reading about loading up with vitamin C or zinc. Don't do that. High doses of vitamin C and zinc have not been shown to be effective. And if they are at very minimum, they may be somewhat effective. But the side effects and the unintended consequences that it can cause with having high doses of vitamin C and zinc, there's no evidence that it would help with the flu, and thus wouldn't help with corona. So right now, like I said, just stay vigilant and practice clean hygiene. So washing the hands, that's the most important thing to do. And like I always tell everybody, my family, my friends, my patients, do the Dracula. So do the Dracula, always do that. So make sure you don't spread it to other people. Very important. Don't go buy masks, guys, if you can find any. Unfortunately, right now there's a national shortage of masks, the N95 masks, huge national shortage. It's very important that we leave these masks for people that actually need them. So hospitals, clinics, first responders, people that are low immune systems. So the real purpose of these masks, the reason why they're made, is so that whoever has already the flu or a disease that could potentially be spread to others, they are the ones that are supposed to wear this mask so that they don't spread it to others. So people that are healthy really have no reason to wear these masks because they're not intended to be used that way. They're intended to be used so that the people that already have the virus don't spread it to other people. Like I said, there is a national shortage. We are down to maybe 10 masks, and that's because we use them for our labs, and we haven't been able to buy any in the last 1 to 2 months because of the coronavirus, and because people are freaking out and buying a lot of them. Also, a lot of people stocked up on them to resell them overpriced. We used to get a box for $3 a box or something like that, and now we're seeing them all the way to 100. So some people make this a business, and they bought all the masks. And unfortunately, like I said, right now there is no reason for you to be buying masks, especially not for your pets. And like I said, it has a lot of unintended consequences because now the places that actually need them, like clinics and doctors' offices and hospitals, and us here at the pharmacy, it's been really hard for us to get a hold of them. So you're not going to find the masks, especially right now since we are in flu season. A lot of people do need these masks because they don't, if you have a family member that has the flu, you want to make sure that they wear a mask so that they don't, spread it to the rest of the family. So don't ask for masks, guys. There aren't any right now. There's no reason for you to have any. There's no reason for you to stock up on any, and doing so actually puts other people at risk. So again, wash your hands. Don't touch your face as much as possible. Don't touch your face. If you have any droplets or anything in your hands, if you have any bacterias or any viruses in your hands, that the best way to get into your body is through your face, your eyes, your mucous membranes, basically your nose and your mouth. That's the best way to get in contact with the virus. And so try not to touch your face. Wash your hands, very important. Also, if you are around people that are sick, make sure you keep at least 6 feet distance from them. That's more or less the amount of space that you need to not come in contact with the droplets. Although these things travel really fast and very far, 6 feet in most part is safe distance to be in space from somebody that is sick. Try to stay home as much as possible. Avoid places that are crowded, of course. That's very important. And again, the CDC right now is not recommending wearing masks, so don't ask for masks. It's very important for us to let those people that actually need them have them. And so those are some things that you can do to prevent it. Again, just stay vigilant, stay aware, be alert, but don't freak out. So I have also had a lot of messages about the CDC currently designating coronavirus as a national emergency, a national health emergency. And so this is freaking out a lot of people because as soon as you hear emergency, you hear DEFCON 1, like, oh my God, everybody's going to die. This is the end, the apocalypse. That's not what it means. Really, this designation is more of a bureaucrat word. It's really more to be able to allocate money and resources for specific things. And so because of that, when you designate this an emergency, it allocates resources and money specifically for this situation. It's also for to help increase the amount of communication and reporting between the states and departments, clinics, and hospitals. They have their protocols to follow when something like this does happen. And so this basically is the government telling these agencies and these departments to make sure that they're on high alert, that they report. That way there is more reporting, more accurate reporting. That way we can catch this at a young stage before it becomes worse. And so that's really what this emergency declaration is. It doesn't mean that right now the threat is at top priority. That's not what it means. It's more for allocation of resources and money. It also means that there will be more increased screenings, like at airports, and there may be reduced flights that will be allowed from abroad. If you're not a U.S. citizen, you may not be let into the country unless you have permission to. And so that's what that declaration means. It doesn't mean, again, that we need to freak out. Again, stay alert. So again, it's very important for us not to minimize the coronavirus. I know a lot of times when I talk to my patients and to my friends, and to a lot of my other colleagues, a lot of them are saying that I'm not taking this seriously, that I feel like the coronavirus is not a big deal. It's not that's not the case. It is a big deal. It is a threat, but it's also very important for us not to freak out about it. Again, to put it in perspective, so far there's been 19 million cases of influenza compared to the 80,000 of the coronavirus. There's been over 70,000 deaths from the flu compared to the 2,000 of the coronavirus. So again, it's not making lightly of it. The mortality rate of the flu is 1.2 to 1.4% more or less. Thus far, Corona has seen about a 2% mortality rate, and it's probably going to decrease because one, the more reporting that there is, the more mild cases that there will be, and then therefore the mortality rate will decrease. Again, if you remove China from the equation, the mortality rate is very, 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 very low. But again, I'm not making light of it. It is important for us to be alert and to be safe. That's really all I have for you guys today. If you guys have any questions about coronavirus, leave a comment. Give us a call here at the Other Guys Pharmacy. Again, stay alert, but don't freak out, okay? And let's just have some Coronas. Why not? Bye, guys.